talk about HIPAA compliance. I just want to give a little credit to Darlene. She's one of my billers that helped me in the preparation of this, so she did a wonderful job. I want to make sure I give her some credit. My slide's not moving. Okay, so first thing is, what's the effect of most HIPAA presentations? I had to put this in here because HIPAA-nosis, a little joke there that I always get the dry material to present. So I'll try to keep it as light and fun as possible, but it's obviously very important material, but isn't the most exciting of material to present. So I'll do my best. So what is HIPAA? HIPAA stands for Health Insurance Portability and Accountability Act. HIPAA came into effect in 1996. It's covered under federal law, and the main intent, the main purpose of HIPAA is for the protection of individuals' health information. We want to protect their information, not be sharing it with people, also helping to reduce fraud, and setting the standards on how we transmit our information. So no, it's not a female hippopotamus. But one word that keeps getting thrown around with HIPAA is PHI. So PHI stands for Protected Health Information. This is basically any information that identifies an individual. It can be in written format, it can be verbal format, it can be something that's recorded, something that's electronic, but any information that would identify that patient, along with any medical information that involves their treatment, their condition, or payment. Examples of PHI, a name, date of birth, I mean, you can read the list, but social security numbers, address, anything at all that really would put some identification to, if I saw this, I would know who we're talking about or be able to find out. So what is the HITECH Act? So HITECH is a part of HIPAA, and HITECH stands for Health Information Technology for Economic and Clinical Health. And this was enacted in 2009. It's to promote the adoption of meaningful use in health information. The main bulk of this is privacy and security. We want to make sure that electronic communication within the medical field of any PHI that we're addressing and making sure that it's kept private and secure. They've also strengthened the civil and criminal enforcement of HIPAA rules, so HITECH really involves around the electronic transmission. The privacy rule. The privacy rule establishes the regulations on how we use or disclose PHI. So anyone who's considered a covered entity, health plans, clearinghouses, medical providers, how we actually use and disclose that. It also requires that we put safeguards to protect that patient's PHI. And then there's also limits that are imposed on how we can use it. So there might be some instances where we can use and disclose information without a patient's authorization, but most instances involve a patient's authorization. The privacy rule also requires that we as healthcare providers notify our patients of their rights, which we do with the notice of privacy practices that we put out for our patients. It also allows the patients to have more control over the medical information they have. So they have the right to examine their health records. They have the right to obtain a copy of their records, and they also have a right to request corrections to their records. Some new changes with HIPAA that went into effect throughout this year, that they are actually starting to enforce the privacy rule more. So they're actually not just waiting for a whistleblower to go out and research. They're actually doing random audits of facilities and looking for this information. There's also some new changes I'm going to go over with this rule. So some people take privacy a little too far. This is a little overboard, but a laugh. So now we have the security rule. So the security rule is basically looking at the standards of how we protect the electronic PHI. Information that we create, even information that we receive, information on how we store it, how we save that information is very important. So a fax coming into you, it's now considered PHI. It's part of our records of our patients. It also requires us to have administrative, physical, and technical safeguards on how we secure our information. There's a new breach notification rule. This works in conjunction with our privacy and security rules, and it basically requires that we report any PHI breach to the affected individual, and Health and Human Services. We have 60 days to report that breach to the individual. We have a little bit more time. We have 60 days after the first of the year for Health and Human Services. Excuse me. So what do? If you have a patient that's complaining or giving you, feels that their privacy has been violated or compromised, what do? You want to act on that immediately. Get the information that you can and report that to me as your privacy officer. Because then I'll need to investigate and make a determination of the breach so that we can notify the correct individuals for that. So what's new in HIPAA? The individuals have new rights of access and restrictions. So was going to go into this a little bit deeper, but a patient has the right to restrict who they release their medical records to. If a patient wants to come in and pay cash for their service and say, don't send any information to Blue Cross and Blue Shield, I'm going to pay cash, they have the right to do that. They also have the right to access their records. If we have electronic records, they have the right to having those records in an electronic format. Something that's new is how we actually determine if the breach is reportable, so we can assess the compromise to the patient, the risk, and make a determination, and how we actually report that. We have to update all of our notice of privacy practices to reflect all of these new rights and privacy practices. And the final change, which was an interesting change, but PHI is not protected after 50 years of an individual's death. And so the main piece to that is more like genealogy. If you need to gather information about your great-great-great-grandfather because you're looking for whatever it might be for health-related issues, did we have this in our history, or we're looking for some genealogy that after 50 years it's not going to do any harm to that patient to release their medical records at that time. So what's a covered entity? I touched upon this briefly, but healthcare provider. And so any provider that transmits any information in an electronic form is covered under HIPAA. Any health plan, which is all basically our health insurances, HMOs, any government programs that pay for health care, so Medicare, Medicaid, TRICARE, any of those, and healthcare clearinghouses. And clearinghouses basically take the information that we have in a non-standard format and turn it into a standard format, or vice versa. So basically, they take our information, turn it into a specified format to give it to the insurance companies for them to process our claims. These are all considered covered entities. They fall under HIPAA. Then there's a business associate. So what's a business associate? And that is a person or company that assists a covered entity like ourselves in carrying out our day-to-day functions. They are now held directly liable for compliance with HIPAA. So an example of that is we have a shredding company. A company comes in, picks up our bins, brings it outside, and shreds it in the truck. They're a business associate of ours. They actually have PHI information in their hands. It's not in a shredded format yet. They have access to that information, and then they are liable from the time they take it and move on. A billing company, technically ABS, we're a billing company. We're considered a business associate. We're directly liable in being in compliance with HIPAA, and we have a business associate agreement in the fact that we protect your information for your clients. And any consultants. We had a consultant come. They did audits, so they're in the charts. So it's really anybody that's actually assisting us with our healthcare functions. Potentially like a cleaner. A cleaner isn't a business associate. They have no means and to be in any of our records. They just happen to be in our facility doing cleaning, and they shouldn't have access to our accounts. What's a designated record set? So this term gets kind of thrown around, and what does this mean? So I just wanted to briefly explain it, that it's basically all records that are maintained by us as our covered entity. Our medical records, our billing records, any records that we have and we use to help us make our clinical decisions. So if you have records in your patients from a doctor, so maybe you have a surgical report, maybe you have an MRI report or x-rays or some other thing that was sent to us for us to continue with the treatment of the care of the patient. That now has become a part of our patient's record. And so that patient has a right to access those records from us. They don't have to go back to the doctor to get that record if it's within our records. And I know there's always been a little confusion about, gee, I have their MRI report here. Can I give them a copy of that? this would make that clear that we should be able to give that to the patient. So what's the difference between use versus disclosure? So there are words that are kind of thrown around through all of this HIPAA. So use is basically us as a covered entity sharing and utilizing the patient's information for us to do what we need to do with it, and it's all within the entity, so it's all within us, stuff that we do internally to carry out our functions. Disclosure then is releasing that information to an outside entity to hold that information. So again, if you're going to go to you sending the information to a physician because you're giving them information about the plan of care is technically disclosure, we don't need authorization to provide that disclosure because it's part of the treatment of the patient, but yet it's considered disclosure because it's going outside us as our entity. So minimum necessary, this is really important for us to understand that PHI is viewed on a need-to-know basis for performing your job. So potentially each and every person listening to this has a different job duty and potentially then different level of which they might access somebody's medical records. You shouldn't be just viewing the patient's information for curiosity or gossip purpose. You happen to be flipping through the filing cabinet and you see John Smith, who's your neighbor. Oh, let me take a look at seeing what John Smith was here for. You know, that's really not information you need to do your job, so not necessarily important. Does the customer service specialist need to sit there and read every single treatment note in order to do their job? No. Might they need to access the medical records to do pieces of their job? Absolutely. So you have to really just, what's minimal necessary information that you need in order to complete your job? Raintree actually has what's called, has like an access control. It's called breaking the glass option. I have a little print screen of this, of where this, it's in the patient demographics. And this allows us to set controls on a specific patient if we want to kind of track access. It doesn't limit access, it just tracks access. So if we potentially have a high-profile patient, which we've had a few, that we're kind of like, you know what, we just want to track this and make sure people aren't just accessing the data just to see, oh, so-and-so was here. Wow, I wonder what he was here for. Again, this tracks everybody who accesses that report. So there's different ways we can set this up, and I'll put a procedure together on exactly how to control this. But the other instance that is going to be a firm procedure is employees. If you're treating an employee, I want employees to feel like their information is secure and that people aren't just accessing it. And I think that you want your patients to be able to be honest with you when you're evaluating them, to give them all the information necessary. In order to do that, they need to feel secure that people aren't just accessing their records. And now that we're on EMR, it makes it a little different. Before, if you logged into RMT, you could access billing information. This actually has health information, past medical history, things like that. And it just, I think, in making sure that any employee that were to come to our facility feels comfortable that this information isn't just out there for everyone to access. So again, it doesn't prevent access, it just tracks access. So notice of privacy practices. So we have notice of privacy practices in all of our clinics, and these reflect the patient's rights, and it controls their use and disclosure. So basically, it's just explaining the rights to the patients. So I discussed they have a new right to access to electronic PHI. So if we give them, if we have the EMR, so Raintree now is an electronic format, if they come in and say, I want this in an electronic format back, we would then have to provide that to them. Any questions if that is asked, go ahead and reach out to me so I can assist you in how we need to put that information together for them. They also, again, have the right to restrict who gets their information, and then also the right to be notified in the event of a breach. So we must update our policies and our notice of privacy practices and redistribute to all of our patients. We also have to post a summary of that, which we usually have in our waiting rooms and on our websites. This is the use and disclosure of PHI. This is actually information that's taken from the notice of privacy practice. I just want to share because sometimes people are like, oh, I can't share that information, or I can share that information, or they're confused on what they should be able to share or what they can't share. So without an authorization from a patient, we can disclose PHI for treatment purposes, payment purposes, healthcare operations, law enforcement, and workers' compensation. So treatment purposes obviously is for us to be able to provide care to our patient. So technically, I know some facilities might go overboard. You want to be more protected than less protected, but Dr. Smith refers patient to us. We need information from the doctor, or we send information to the doctor. That's a disclosure that doesn't need authorization from the patient. This doctor is direct relation to the care that we're providing the patient, and we can go back and forth with that doctor with the intent of we're treating this patient. For payment purposes, we can send information to the insurance companies because that's how we get paid. If workers' comp needs a copy of our records, then those records would go to workers' comp with every claim. They have rights to have that. We don't need authorization to do that. Healthcare operations, there's certain day-to-day things that we might do internally that is okay to do without authorization. One of the big things that this points to, we don't do this in our facilities, but would be like a sign-in sheet. People would say a sign-in sheet, if that's the way you carry out your healthcare operations, then it's okay. But then you have to do a risk assessment to evaluate what is the risk of having a patient's name on this sheet of paper. Are there safeguards that we might take to say, okay, the patient signed in, but we're removing it so other people can't see it. But in general, you're doing your healthcare operations and a risk assessment and evaluate that from there. Law enforcement. This would be one area that they generally would have, in certain situations, the right to this information. And I would just direct everyone to contact me or an owner or somebody if there's a situation that arrives, that somebody shows up on your door saying, I need this information. Who are they? Are they Health and Human Services? Are they FBI or whatever? Most likely that they're going to be okay to be granted access, but I wouldn't just want you to be, for fear of being like, oh my gosh, I have to give them everything and give them something that they shouldn't have. You know, that's kind of the theory too when Medicare shows up at your door. I mean, in certain instances, Medicare just can't show up at your door and just be like, give me all of your records. You know, there has to be some caution to that. So don't just kind of get caught up in the loop of like, oh my gosh, I have to give them everything they ask for. Really take a step back, count to 3, and think about what the situation is, and reach out to one of us if there's any question. And then workers' compensation, which is similar to payment purposes too. Okay. So according to our HIPAA releases form, I can't share anything with you. This kind of, again, isn't true, but kind of a lot of people go overboard and need all their I's dotted, their T's crossed to make sure they can talk to anybody, which leads me into this slide. So the way HIPAA is generally written is you can speak to a family member or close friend without having a release. And so as you read all the manuals with HIPAA, we have to give them an opportunity to say, I don't want you to speak to this person. So some facilities actually say, who can I give information to? And then you can specify the information. But in reality, if we give you an option to say, don't give this person information, then we have to restrict who they tell us to. But like, again, a close friend or family member, that really the information that you're providing them is in the best interest of the patient, and you really have to think about that. You're not just going to so-and-so's close friend and saying, oh, yeah, blah, 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 and giving them all this information. It's really on an as-needed basis in the best interest of the patient. So if a friend or family is with the patient says, come on back with me, you obviously can have conversations with them in the room. The patient gave their consent. If a friend or family member comes to pick up medical supplies, you can provide that to the patient. Questions always come up about leaving messages with a family member or even on an answering machine. And here's a situation where you can leave the information with either. Just limit the amount of information that you provide. Don't be like, oh, I'm calling about your $2,500 bill that you didn't pay from 3 years ago for this and this and this. You want to leave limited information. You know, I'm calling just to remind Jim that he has an appointment on Wednesday. Have him give me a call if he has any questions. You know, don't give all the details of it. And take a step further about talking to family members is that there is some common sense that comes along with that. So Greg's treating me, and I've gone for my treatments and all this, and then Chris decides to call up Greg and say, hey, Greg, did my wife show up for treatment yesterday, and what did you do with her? So Greg might think, is this really pertinent, and is this in the best interest of Janet's care? maybe he chooses that I'm not really able to give you much information about that. Why don't you speak with Janet? So turn that around, and Chris calls Greg and says, you know, you treated my wife yesterday. She can't even get out of bed. She's in so much pain, and I'm just really not sure what I should do. She can't even come to the phone to speak to me. That might change the situation, and Greg may want to give Chris some information about what he can do and advise him because the situation is different. So you still just have to be careful of the type of information that you're providing, and is it in the best interest of the patient. So individual patient rights, these are taken directly from our Notice of Privacy Practice. I've covered most of them, but I just discussed the ability to speak to a close friend or family member. The patient has a right to restrict the use of that, so they could write down that I could write on my form saying, don't speak to my husband, and give that information. They have the right, obviously, to receive confidential information about their treatment. I'm going to just repeat this because I know this is one of my scenarios, but the patient has the right to restrict disclosure of their information to a health plan if they're paying in full for that service themselves. Patient walks in and says, I have Blue Cross and Blue Shield. I don't want you to bill Blue Cross and Blue Shield. I want to pay cash for these services, and I don't want you to release any information to anybody about it. If the patient's direct access, I don't want you to send anything to my doctor, or, you know, that's all information. They have the right to do that. It changes if it's Blue Cross and Blue Shield. They can't come in and say, don't release my information to Blue Cross and Blue Shield. If Blue Cross is requesting that information for us to get paid, we're going to have to release that information to Blue Cross and Blue Shield. So that actually has already happened in one of our facilities, and I have a scenario on that. So just be cautious of that happening because people may exercise that right. Patients have a right to inspect, access, inspect, and copy their records. And then the other one, I know we've had some questions with this before, the right to amend or submit corrections to their health information. And I would always, if someone has a question about this, a patient asking them to make a change to their record, please call me if you have any questions, because it may, you know, ethically, too, we have a right, and you can't just be like, I'm just going to amend this because the patient says, well, I didn't do this, or I didn't say that, or whatever. There's going to be certain limits to that that are going to stretch you to say, I don't want you to be not truthful in your notes either, and there might be certain aspects that we have to be careful about how we are amending according to the patients. And then they have a right to receive an accounting of all disclosures, and then they also have a right to receive a copy of their Notice of Privacy Practices. So violations of HIPAA, we are all responsible for HIPAA. We as a company, as well as you as individuals, so we all just need to make sure we're doing our best to us to be able to provide for you, and you guys also keeping the patient's interest at best too, because we can face fines, face jail time, losing your job, that kind of thing. So I have two quick scenarios. One I've already kind of put out there completely. We have a patient who comes into the clinic and says, don't release any of my medical information to anybody. I don't have a doctor referring me. I'm paying cash. Don't release any information for this visit or any of my past visits. Now, the patient has like 7 past charts. So what do we do? So if the patient's self-pay, again, as I just discussed, that's okay. But if they have insurance, it does pose a little bit of a problem. If it's a workers' comp, we've probably already submitted those records, but if we need to release those records again to get paid, we would actually have to release those records. Of course, it could also be that if it's Medicare or Medicare were to audit us, then we would have to be able to release those records to Medicare. So in these instances, I would put a flag on the patient's chart. I would also go, I mean, this is actually a real situation that happened. I went back to the patient's charts in the attic and put notification in there. So basically, if someone were to get a request for medical records on this patient, they would pull the chart and they would see that there is a request not to release any medical records on this patient. And at that point in time, they would call me and say, we have a request for this patient, and then we would actually reach out to the patient and let them know that there's a request for records and we're going to need to release this information. If I can get a release from the patient, that would be even better, a little added security, but it's not required because those past visits were being treated under a payer that we needed to release. So scenario 2, patient walks through your door. This has happened a couple different times. Patient walks in and says, you know, I asked for a copy of my medical records, and they have copies of other patient's medical records as well. Or one other situation we had is a patient got a statement, and by chance 2 statements were actually clipped together. So they had 2 patient statements, one not being theirs. And so what do you do? If the patient's in front of you with the information, great. Take the information from them and apologize, and then I need to be told about it so that I can do the appropriate steps that I need to report the breach to the patient and Health and Human Services. But if they're not in front of you and they call you, we actually have to request that they pretty much demand that they return that information. It's not their property. They need to give us the information, not just tell us who it is. They need to bring us that information so we can evaluate what the information is, and again, how damaging is it to the patient, and make sure we can report that information. It's far different with, depending on the information. Like another quick scenario is there was a briefcase stolen that actually had some information in it, and we were able to pin down what information was in it. Now, if it had a patient's name, it is PHI, but not as big of a deal as if it had their Medicare number, which is also their Social Security number and their name. So now someone could potentially take this information and have a Social Security number, a Medicare card, whatever, and that's a little bit more damaging. So you have to evaluate each scenario differently, and that helps in reporting it to the patient and how damaging it would be. There's also a spot in Raintree that has a spot for us to put all of our disclosures. So on this is a screenshot within the patient chart. It's on the communication tab. And on the lower right side is a spot for us to be able to add any disclosures that we have. So I'll be putting a procedure together. I don't want to go too much procedurally in here about what kind of information that we should be logging in those disclosures. But this information we definitely would be putting in there. All right. So kind of the rest of the stuff here now is safeguards that we can take to help protect our patient's PHI. And so the first thing we can do is designate a spot where we dispose of our patient's information. So I've been in many clinics. Some are great. They have a shredder. Shredder's being run all the time. Information goes in. Other clinics, you have piles of paper sitting on top of the shredder because it takes too much time, or the shredder died, or it just can't handle too big of a load. We need to be handling that information quickly. So if your shredding doesn't happen quickly, we have a company that we've been using in some of our facilities that you basically put the papers in the shred bin. The shredding company comes, they take the bin out, bring it out to the truck, and shred it on the truck. So that's been very helpful, and it's just a little bit more protective. The other piece, too, is be careful on what you use. I appreciate that everyone's trying to be cost savings and use extra pieces of paper as scrap paper. Just be conscious of what's on the back side of that scrap paper, because by chance you take a piece of scrap paper, don't be using anything with PHI on it as scrap paper. So if you were to look to see, oh, all of these pieces of paper should be shred, put them in the shredder, because then what happens, you take scrap paper, you write on the scrap paper, what I wrote isn't confidential, you throw it in the garbage, and on the back side of it, it had PHI. So you just have to be cautious of that. De-identify information. So in that scenario I just used, if all it has is a patient name and you want to use a black magic marker and black them out and use it as scrap paper, fine, you've de-identified it. You want to remove specific identifiers that identify the individual at all. And it could even be that there might be other information within the context, a family member, household members, employers, something else that might be able to identify that patient. So you want to make sure there's none of that information as well. We do this for training purposes. I certainly have used it 100 times in printing out Raintree procedures. You take a scenario, you print screen it, you remove the patient's information from it, and use it in our procedures. We also can use it for case studies where we want to use a patient as an example. The patient's like, I don't want you to use my name for anything, but we can use the information to demonstrate either for marketing purposes or discussing how we handled this care with a patient for learning purposes. So the other piece is probably my most concerning piece of safeguards that we need to all be extremely, extremely conscious of is not using PHI in an email. We, need to either de-identify it if possible, or if you can't de-identify it, meaning like if you talk about in vague sense, I don't want to talk about patient X specifically, but it's certain scenarios, that's fine. But my recommendation would be if you have to put it in the body of the email, just use a patient ID number. So without access to Raintree or RMT, the ID number really doesn't mean anything. I'm on patient 5555, then you can go to 5555 and find out who they're talking about. You can also attach a password-protected file to the email. So again, making sure in the body of the email doesn't really contain much information. And then when you open up the file, that gives you the patient's information that you need. Just don't send the password in the same email. Oh, so here's a password-protected document on Jane Doe. Password, by the way, is ABCDE. So just make sure that the password is communicated differently other than in that email. We also still have SharePoint that is assists in passing on information, and that is a secure website because you have to have a username and password to log in. So that is one of the most secure ways of passing on files. And then Braintree has the tasking system, which is actually the whole purpose of having that tasking system is to avoid being able to having to communicate via email about some of this information. So just make sure that everyone is up to date and using their tasks and watching their tasks. Limit conversations about PHI. So be aware of your surroundings. Who can overhear you when speaking? So are you in the waiting room? Should you bring the patient back to the treatment room? Again, evaluating what it is that you're discussing. If it's, I'll see you tomorrow at your treatment, great. We're going to start some new exercises. Maybe not a big deal, but discussing there what you're actually treating maybe needs to be in the treatment room. Be conscious of who's in earshot. You know, are you on the phone calling an insurance company about a patient and there's another patient sitting in the waiting room with like 2 feet from you that can overhear everything you say? Just be cognizant of who's in earshot when you're talking on the phone. Not really doing what this woman is doing and basically telling everybody in the waiting room what's going on. Limit the visibility of computer screens. Now that we're on EMR, computers are actually out in the open a lot, so making sure that your screensaver does come on within a couple minutes of idle time. But if you are walking away from your computer and you know you won't be back for a period of time that it's going to be idle, log off. You know, if you're just walking back to the printer, not a big deal. If you're going to go take a bathroom break, log off so it's actually not up there open for anybody. Be sure your screen's not visible to patients, whether you're in a room or out in the gym. And don't allow patients behind the front desk area because obviously that's where your computer screens are. If your computer screen is visible to someone, so if you're at the front desk and you can't really move your laptop around because you're on a regular fixed monitor, we need to take precautions to fix that as well. So if you have concerns about some of the setup, speak to me about that so we can work on safeguarding our information. Keep your workstations free of paper. Basically, if you have something on your desk, flip it over if you're walking away, but you also don't want someone being able to walk up and just reach in and grab whatever it is that you're working on. Another thing with faxing that is recommended is, obviously a lot of our faxes we know where they're going, but you could always call after sending a fax to confirm it's been received. But for the most part, verify that the number that you mean to send it to is who you actually sent it to. So check the confirmation or check the number as you're dialing it and cross-check and just double-check and make sure that it's actually the number that you are faxing it to. Identify all your visitors before accessing areas where PHI is stored. So you have a maintenance person coming or a delivery person coming. We should be escorting those people back through those areas with PHI so that we know that they're just not wandering around picking up stuff that might be left out or whatever. So we just want to be very conscious when we think about that when we're at the admin office. We had a pest control guy walking around. And it's kind of like he's just up and around walking everywhere into nooks and crannies. But yeah, we have a lot of information in this building. So you always want to be cognizant of where they are, what's going on, and what they're doing. Also locking our files, file rooms, or anything when we're done with them so that we're not just leaving paperwork out. I know I mentioned the cleaners. We have to try to be careful and protect their information so that if somebody's walking into the building, that information just isn't left for them to kind of pilfer through. So new notice of privacy practices. So I revised, I think Shannon already sent them out to everybody. I've revised the notice of privacy practices for each clinic. With that, I've also revised the acknowledgement that they sign. We used to have the consent for treatment and the acknowledgement on a combined form. I've revised the acknowledgement to allow the patient the opportunity to put anybody that they would prefer their information not be shared with. And then because of that, I had to modify the consent for treatment. So we should be getting, you should have gotten a notice of privacy practices, a new acknowledgement, and a new consent for treatment. So for current patients, we basically, we have to make sure that we offer the new Notice of Privacy Practices to all patients. They don't have to take it. So they don't have to force it down their throat. If they want to read it, you could basically, my thought is you put it on the clipboard with the acknowledgement on top. They can sign the acknowledgement and they can take the Notice of Privacy Practices, or they can leave it on the clipboard and hand it back to you and you can reuse it for the next patient. But we actually have to make sure we have all current patients sign a new acknowledgement. So I suggest, if you have them and you can start collecting them now on your next visits that the patients come in, we need to get that in there and scan them into Raintree or put them in your patient's chart if you're still on paper at this point in time. So that's for current patients. And then starting now, all new patients coming in will just offer the new paperwork. So you're going to obviously have the new acknowledgement, the new consent, put the Notice of Privacy on the bottom with the acknowledgement. So again, they can fill out their paperwork, and if they want the notice, they can take it with them. Otherwise, they can leave it on the clipboard for you. And then, so that we can start that process right away. So all the clinics should have a binder in their waiting room that have the Notice of Privacy Practices. We need to replace that with the current new one today. So if you can actually remove that from your binder and put the new notices in. If you don't have a binder in your waiting room with the Notice of Privacy Practices, get one. Shouldn't be too difficult. You have the notice. If you need help shouldn't need help, but if you need help, go ahead and let me know. And then we'll also be posting these on our websites as well. So that's our HIPAA presentation. Hopefully we have people that are still awake out there. I don't know if anyone has any immediate question that they want to actually type into the bottom of their GoToMeeting screen. Otherwise, I would just shoot emails to me with any of your questions, and as the questions come in, we'll put together a frequently asked questions so that I can share that information back with everybody so that everyone can see the answers. And also, again, this is being recorded. So anybody who was not present, wasn't able to get this information in your clinics will get the recording to you so that they can all listen to it. And we'll be sending out a quiz later today for you so that we have, again, the accountability. Okay. And if there's no questions, I thank everybody for participating. And So there's a question that just popped up about how we use email to contact MDs about patients if that's their preference of communication. So I would communicate with the doctor because there's a couple different things that can be done, and we'll have to explore some of the options and probably discuss with the doctors how they want the information to be handled. They must be doing this very regularly if that's their main sense of communication. There is encryption that can be done. With encryption, we need to make sure that they have the same encryption that we have. Or, again, my suggestion would be is come up with a password potentially that the doctor's aware of that we can communicate back and forth. But I know we'll have to finalize a little bit more procedurally with what's going to be the best way. And for those that actually go out and do any marketing, for those doctors that do request that, my next question to them would be, how do you safeguard that information for your patients so that we then can follow that same guidelines and make it easy for them? Okay, any other questions that someone might be? Okay, very good. Thank you, everyone. And any other questions that come through, I will definitely get back to everyone so you know the answers.